I'm Michelle Malik, and you're watching Indus Special. One child every 39 seconds dies due to pneumonia. According to this new analysis last year, 800,000 children died worldwide because of this illness. On today's show, we take a closer look at the factors which make children vulnerable and what needs to be urgently done to save lives from this preventable disease. Joining us for this discussion today is Dr. Yasin Nassar, representative of the World Health Organization, joining us from Geneva. Also joining us today is Mr. Edmond Fernandes, community health physician and global health expert, joining us from Mangalore. Thank you both for joining us and welcome to the show. Dr. Nassar, I'd like to begin with you. Now, this new analysis that I'm talking about, in which one child dies due to pneumonia every 39 seconds, it also states that this is a forgotten epidemic. Do you think that is the case, and why so?
There is no doubt about that this is a forgotten epidemic because of the several reasons. As you have aware that there are about 800,000 deaths due to pneumonia every year. And it's not only that, the burden of disease is also very high with all the efforts which we are doing in the last several years. If you see that among those under 5-year-old children, the case of pneumonia among 1,000 children, it's 14 cases per year globally. However, in South Asia, it's a bit higher. It's 25 cases per 1,000 children per year. We have seen some reduction in pneumonia-related death in the last 18 to 20 years, and there is a reduction about 54% due to pneumonia-related death. But on the other hand, if you see that this is not a significant reduction by seeing the other infectious diseases in this age group, like diarrhea, where we have seen that 64% reduction in diarrhea-related mortality in the same time frame. Other reason is that we have seen that this, with all the efforts, it's not only on the preventive side, also on the treatment side, the deaths are still on a higher side. And there are only, if you see in the death proportion, there are 5 countries all around the world which has about 50% of the death. And these 5 countries are 2 in Asia, Pakistan and India, and 3 in Africa, Nigeria, Democratic Republic of Congo, right, and Ethiopia.
Right. Dr. Nassar, you correctly mentioned here that only 5 countries are responsible for half of these child deaths due to pneumonia. And 2 of these belong to Asia, India, and Pakistan. And now, when we're talking about this, India and Pakistan having such high rates of children dying from this, of course, we have to take into account the environmental factors contributing to this. Shed some light on that.
We know that there are some risk factors, environmental risk factors, which leads to pneumonia. One of them is air pollution, indoor air pollution, which is actually one of the risk factors for pneumonia. And we have seen that in the last 20 years, the level of indoor air pollution is static in South Asia, despite all our efforts. The other is overcrowding. Due to overcrowding, the basic cause of pneumonia is a viral or a bacterial infection. So with overcrowding and a poor hygiene, there is more chances of getting pneumonia as compared to other diseases. So I think the environmental factor play a vital role here to prevent pneumonia cases.
Right. Now, when we're talking about these environmental factors, and Dr. Nassar told us about the several risk factors that are contributing to this, we're also seeing worsening climate, we're seeing worsening air pollution, all of this combined. Do you think there is a realization amongst policymakers, amongst health experts, that the domino effect this is leading onto the health sector?
This entire statistic points out 2 things. While it's alarming for India, Pakistan, among the Asian region, what we also need to understand is, have the 2 countries sincerely trained parliamentarians in this light? I mean, it's very nice to hear international organizations talking about statistics saying one child dies every 39 seconds, or proportionate to that, 2,200 children dying every day. But how many of our parliamentarians really know what is an action plan or a framework that really needs to be put in place to tackle upper respiratory infections? So
Right.
the starting point for at least India and Pakistan would be that have a special sensitization session for parliamentarians, which then trickles down to state legislatures about what are the policy actions that are possible in this direction.
Right. Edmond, now I detect some sarcasm coming in your tone when you're talking about these international organizations quoting these statistics. Can we dig a little deeper into that? Where is that coming from? Do you think international organizations are also slacking in some regard?
I mean, I would like country governments to look at life beyond statistics, life beyond a number. I mean, look at that child flashing on the screen out there. That child doesn't know what policymakers are talking, what are the current established practices in the respective countries. What we really need to arrive at is how do we become the voice for that voiceless kid? I mean, it's good to have statistics, it's good to have numbers, it becomes a media hype for a few days, but realistically, from a global health perspective, we need to get down to the grassroots, also probably engage parents interaction with grassroots level workers. Like, for example, in India, we call these workers Anganwadi workers, or you also have foot soldiers in Ashas, who's called an accredited social health activist. I mean, likewise, each country has their own terminology or nomenclature for it. This is where we need to start.
Right. Now, Dasar, going back to you and talking about what international organizations should be doing. Now, after these statistics came out, it created quite an alarm. Many health experts realized that there was an inertia on the global front as well. Of course, as Edmond mentioned, there is much to be done at a country level. But what do you think needs to be done urgently at an international level?
You know, this is a multi-sectoral effort. There are two things to avoid deaths from pneumonia. One is to prevent pneumonia, another is to treat pneumonia appropriate. And WHO has guidelines on both. We have the framework, which is a protect, prevent, and treat framework, under which protect and prevent means to like reducing the risk factors and promoting the good health practices like exclusive breastfeeding in the first 6 months of life, including the appropriate complementary feeding and immunization, not only with the pneumonia immunization, but also measles is very important to prevent pneumonia incidents in these areas. Other is a timely recognition of disease and appropriate treatment. So WHO has the guidance for that, not only at the community level, but at all three levels. And all three levels are at the community level, at the health facility level, which is actually a primary healthcare level, and at the hospital level. It's the difficulty is how to scale up these guidelines at the country level, because we know that in some of the places the accessibility to the health facility is really difficult. And on there we have, as mentioned before, also the other expert, that we have community health workers, and we have given mandate for some of the cases of pneumonia to be treated by the community health worker without referring them to a higher facility. And we have seen some success also. So now it's up to the countries, especially their political leadership, to implement these guidelines with the help of international organization to provide them technical support. And I think once it is scaled up, we will significantly reduce the mortality due to pneumonia or deaths due to pneumonia. Although we have achieved 50% reduction in the last 20 years, but this process is a bit slower in few of the countries.
Doctor, one thing that I do want to get to is when we talked about environmental factors, I mentioned how climate change is exacerbating many diseases, how air pollution is increasing, that exacerbates many of the issues we see. Pneumonia is one of them. Now, as we're seeing worsening climate, as we're seeing weather patterns change, of course, this is a global phenomena. And the poorest countries are at the worst end of this all. What is being done on the financial end to support these countries? What is being done at an international level to provide funds for support and for development of health facilities in these countries?
You have rightly said that there is a gap in this situation, and we have seen that. I again quote the data because data drives us to go where we are and the future. Also, the environmentals, we have less financial expenditure on environmental, and this is why I'm saying that this is a multi-sectoral approach. It's not only the health can give you some of the guidance, but then we need other sectors to be involved. Educational factor and environmental sector, we need to involve them, and we need to involve international organizations also to provide them technical support, also the financial support if needed. Alone, to prevent pneumonia cases alone by health sector, it is quite difficult. So we need a multi-sectoral approach to reduce this disease.
Right. Edmond, now you mentioned how there needs to be greater awareness amongst parliamentarians. That's the first step, to sensitize them to the issue, to get them to be aware what is actually happening. Now, when we're talking about these issues, we do know that some people are more vulnerable, especially those belonging to lower income backgrounds, those who are more exposed to the environment. Greater risks are, of course, they're burdened with them. Now, in all of this, what do you think practically can happen and should happen urgently?
So it's quite simple. I mean, if you look at the number of children dying with regard to the amount of spending, it is pro-poor. And this protects the poverty that already exists. So one is to step up investment in terms of both government investment in healthcare and at the same time investment in healthcare through the private sector. Now, I'll give you an example. I'm associated with an NGO in India called CHD Group, and this organization works in the space of public health with malnourished kids. So let's think about this as a policy strategy. Why not the government step in where you're already working with malnourished children? So bring accountability in scaling it up further, saying that, okay, you also ensure vaccine coverage is there in terms of pneumococcal vaccine. And there's also timely reporting done both from the government medical officers and also from the private practitioners in terms of notification of the disease. This would be a very small step, but it would go a very long way in changing the futures of countries, particularly Asian settings of India and Pakistan. Of course, West Africa would require a more concerted approach, a more detailed policy change coming into what already exists. But at least these are certain small changes that can be adopted.
Right. On that point, thank you so much, Fernandes, for joining us from Mangalore. Dr. Nassar, that is an interesting point that Edmond put out, that we're not looking at these opportunities of investing and participating, collaborating with private companies, trying to bring them into the loop, trying to expand this network. What do you think needs to be done at an international scale, trying to localize it in order to create this culture where it's not just the public sector that is trying to strengthen the health facilities, because this is, of course, a systematic problem?
Yeah, thank you. We know that in Asia, we have a very strong private sector also, and research has shown us that more than 70% actually take care from our care seeking from private sector. So that is why we need to make these private sector to be part of this whole approach. However, we need a good legislation to standardize the treatment in the private sector also. We know that we have many GPs and somehow in Asia where they are closer to home and people used to go there for care seeking. But the standard over there and the quality of care they are providing, they are somehow not up to the mark. I'm not saying that we cannot improve it. We can improve it. We need a good legislation, and we should involve the private sector whenever it is possible. But having said that, we need a good legislation also how to standardize treatment at the private sector, because I have seen that in private sector there is no standardized treatment. They are giving from low generation or the first line antibiotic to those which we call as third line antibiotic, which should not be used in a simple pneumonia cases, and they are using that. The unnecessary, sometimes unnecessary, they are doing hospitalization which don't need it. So that is why I'm saying that we need a good standardized approach and good legislation to standardize treatment at the private sector also.
Right. There were recent figures that indicated that if we don't try to extend our health coverage of people, especially for those who belong to the lower income backgrounds, we don't move towards universal health coverage, almost 500 million people will be left behind from this envelope. Now, when we're talking about all of this, how far along do you think we've come in being able to provide accessible and free healthcare all across the world?
I have told you that in those areas where hard to reach areas where the accessibility to the health facility is quite difficult, WHO along with UNICEF recommend community health workers to be there and train them to treat simple pneumonia over there and other diseases also in childhood. So using that approach, there is ample evidence from the research which has shown us that community health workers can reduce, if they are trained and provided with the logistics like antibiotics and other equipment, they can reduce pneumonia related mortality. And I think in those areas we should use community health workers. In almost now many of these countries like India, Pakistan, in Pakistan we have lady health workers program, which is a very successful program. So we can utilize those lady health workers, which is actually closer to home for the treatment of pneumonia. And they have doing some of great work in Pakistan in reduction of mortality in childhood related to other diseases like diarrhea and somehow to pneumonia also. So one thing is strengthen the community health workers program to improve the universal health coverage. At the same time, we need to strengthen the public sector health facilities at the primary level so that it can be accessible and the quality of care should be improved over there. And lastly, we have to improve the quality of care at the hospital level also.
Right.
So combining all these three together, we can improve the not only
right.
the
Nassar, those are all very important points you've highlighted, but I'm out of time for this show. But we will see you next week with more stories. Till then, goodbye and take care.